Well, hello there. How are you? I'm so excited to be back this week. I have a great episode for you. I'm actually really excited about this episode, and I'll tell you why. I decided that you all, my listeners, are going to become super educated in GLP-1 agonists. Okay? And the reason why I think this is important is because there's so much misinformation out there, and GLP-1 agonists are here to stay. Okay, so I would love to share with you just a little bit about the history of GLP-1 agonists. I'd love to share with you about the mechanism of action. I'd love to share with you, who's a candidate, okay? And where do we see the future? What do we see happening with the use of GLP-1 agonists? Okay, I already mentioned I don't see it going anywhere, so that gives you a little bit of a clue. Now, with all that being said, let's start with a little story. Okay, so this past weekend, we went to pick our girls up in Ocean City, New Jersey, and we decided we would stay the weekend. And so we had a lovely time in Ocean City, New Jersey. It was fabulous. And one of the things that was really cool is that I met a woman who was working in a shop, and she asked what I did. I told her what I did, and she mentioned that she has family members on GLP-1 agonists, and she didn't really understand them. And it was really cool because she was not at all judgmental of them. But what she had said is that she just didn't understand them. And I thought, wow, what a great opportunity to share with her a little bit about what I know, and then also sharing with you all, okay? So just a beautiful moment, because a lot of times GLP-1 agonists really get a lot of hate, if you will, because a lot of individuals think that this is an easy fix and that it's being abused and all these different types of things, which again, the population that I work with, I can tell you, they absolutely are thriving if they need the medication. Okay. And I say if because, yes, it is for a certain individual. And it's for an individual that needs help leveling the metabolic playing field. Okay. Because it's not the easy answer. I'm going to go ahead and say that right up front. Going on a medication for weight loss is not the easy way out. If you're going on a medication for weight loss, essentially what you're saying is that your weight is negatively impacting your life, and you've tried all of the things and you haven't been able to achieve any movement. And so that's one of the reasons why I love my programs, because I have one program where you come in, we do all the lifestyle things for an entire year, and then if we haven't moved anything, then we know that it might be time to augment the weight loss journey with a medication. Okay, so it's a really nice approach. And to be honest with you, individuals who are doing all the lifestyle parameters first and then utilize a medication, if their metabolic health requires it, we see fantastic results. Okay, so let's go into the history a little bit. Okay, so the first thing I want to say is that there's the GIP, okay, gastric inhibitory polypeptide. And then there's the GLP-1, and that's the glucagon-like peptide receptor agonist. Okay, and how these are important is because when you're talking about GLP-1 agonists, you're talking about Ozempic, you're talking about Wegovy. So these are your semaglutides. And then when you're talking about the GIP combined with the GLP-1, those are your tirzepatide. So this is your Zepbound, your Mounjaro, okay? And what we found is that there is a better effect, if you will, for lack of better phrasing, with the tirzepatide. So it tends to create more weight loss, okay? So if semaglutides are creating 10% weight loss, then tirzepatide is creating 15% weight loss. Okay. So the reason why that's important is because, well, think about it this way. We are constantly evolving and creating new tools. Okay. So at first it was the Ozempic, and then it became the combination, the dual therapy, and already showing remarkable differences. Okay. So the thing that's amazing about this is that when we think about our society, right, we know that if we don't make any changes, then we're heading down a pathway where our metabolic health overall is going to be not good. And at this point, having something to help level that out is really where I see the GLP-1 agonists fitting in. Okay, so GIP was really discovered in the 1970s. Okay, not that long ago. Okay. And essentially from there in the 1980s, GLP-1 was isolated, identified. In the 1990s, the first GLP-1 agonist was used to treat diabetes. Okay, so that's how GLP-1 agonists were used initially. Okay, diabetes. So they weren't initially made for weight loss. The secondary effect of these GLP-1 agonists was weight loss. Okay, so individuals who were taking GLP-1 agonists for diabetes were improving their blood glucose, they were becoming more insulin sensitive, and they were losing weight. Okay, so from here, right, it evolved, it developed, and then more recently, medications really became a household name, if you will, for weight loss. Okay, so one of the things that's interesting is that most people's exposure, and I say most people because this is why, let's say that over 50% of our population by BMI chart standards, which I don't love those charts, but let's just say classified with obesity, let's just say 50%. Okay, only about 4% of individuals with obesity are being treated with medication. Okay, so think about it this way. A lot of people would tell you, well, everybody's on a GLP-1 agonist, and that's just not true. Okay, and so we have a lot of exposure to celebrities, to Hollywood, to all the things. And so a lot of times, remember, as humans, we get all of this information. Some of it is accurate, some of it is not, and our brains start writing stories about it. Okay, so there's a possibility that many people believe that it's the easy way out, that everybody's getting this GLP-1 medication and it's the easy way out. And what I'm here to say is it is by no means the easy way out. Okay, because when somebody is committing to going on a medication, they're now committing to injecting themselves with medication. They're committed to more medical follow-up visits. They're committed to really having to adhere to lifestyle parameters like nutrition and exercise, because when you commit to go on a GLP-1 agonist, potentially there will be muscle loss, not because of the medication, but the medication drives down the appetite so much that many people don't want to eat. And if they're not eating enough protein and if they're not moving the muscle, they're going to lose muscle mass. Okay, so it is actually a big commitment to go on a medication. Okay, and what I will tell you is that individuals who are seeing their primary doctors or obesity medicine physicians, and they are being prescribed appropriately and they're being monitored appropriately, this is an excellent tool. However, it's just a tool, okay? Because I've seen many people on GLP-1 agonists and they are not losing weight. Okay, so they're not losing weight because exercise, nutrition, mindset work, consistency, those things have to be in play. Okay, so somebody who is getting results on a GLP-1 agonist, they are doing the work. They are doing the work. Okay, so I just want to put that out there because when you hear GLP-1 agonist, or mostly you're going to hear Ozempic, everybody's saying Ozempic. So somebody could be on a tirzepatide type med and everybody's calling it Ozempic. But anyways, you hear Ozempic and what do you think? Your mind is going to Hollywood and how all the celebrities are taking the medication from all the people that really need it. And to be quite honest, right, this is just like a sliver of what the media tries to show us. Okay, but the reality is there are many patients that have subpar metabolic health that are actually prolonging their lifespan by being on a GLP-1 agonist. Really, the idea here is that we're using the medication responsibly, okay? All right, so we talked about it leveling the metabolic playing field. Let's talk a little bit about who's a candidate for a GLP-1 agonist. Okay, so if you're looking at kind of the standard of when you would prescribe, you know, the magic number for BMI is 27, okay? So with that being said, you know, insurance plans may or may not cover the medication. Okay, and that's one of the bigger things, right? So let's just put it this way. If somebody's not qualifying for a GLP-1 agonist and they're getting it, you know, through their provider, and let's say the provider is not doing compounded, so I'm not going to talk about compounded today because that's a whole other episode, but let's just say they're getting it through their provider, you know, to get the medication, you know, approved by the insurance is kind of a miracle. Okay, so the idea is that if individuals are getting the medication, they need the medication. Okay, so I think that that's a really important point as we educate ourselves, All right. Because what we have to trust is that, the doctors know what they're doing. All right. And the fact that we have this tool available to us is really nothing short of a miracle. Okay. When we talk about longevity, we talk a lot about inflammation. So one of the things that we know GLP-1 agonists are helping with, inflammation. Okay. So when we talk about it reducing heart disease, we're talking about the reduction in inflammation. Okay. It's going to be approved for osteoarthritis soon. Okay. The next piece, what about dementia, Alzheimer's? If it's improving that, inflammation potentially. Okay. So the idea is that the medication, okay, is creating this potential for longevity. So my question and what I put out there as we discuss this in more detail, because remember, you're going to be the most knowledgeable people out there as it relates to GLP-1 agonists. So what I put out there is, are we going to wait for somebody to enter into the obesity range before we give the medication? Because if we're letting that happen, we're letting a lot more inflammation happen and we're letting a lot more chronic disease enter in versus hitting it early and potentially being able to use a very low dose and helping the patient be able to institute lifestyle parameters like exercise, like nutrition, mindset work, community, okay, all those things. And they're going to avoid a lot of the problems. So when we talk about pros and cons, okay, I'm getting into who's a candidate, right? Any medication has a side effect. Let's be honest. Vaccines, they have side effects. No doctor is going to sit there and tell you that these things don't have side effects. Really, what needs to happen is that individuals need to make their own decision based on pros versus cons. If the pro of going on a medication, so curing metabolic disease, improving inflammation, decreasing the likelihood of cancers, decreasing the likelihood of chronic inflammation, feeling better overall, if those pros outweigh the cons, right, which can be, right, any side effects you hear about. So let's just say severe reflux, let's say pancreatitis, let's say all the things that potentially are side effects. Okay. And by the way, I'm going to break down like the side effects as it relates to most common versus least common. Then that's going to be the first step. So, actually we'll say second step, because the first step really is, are you a candidate? Okay. And so who is a candidate? And so it's the idea that, okay, you could have a certain BMI number and be a candidate. You can have a certain medical pedigree and have the ability to, get the medication. And the idea is that, right now we are using BMI, but what if you have somebody who has a BMI of 26, so not quite 27, and let's say they have significant insulin resistance. Okay, let's say they have significant leptin resistance, and leptin resistance is a very interesting one. I'm going to talk a little bit about that. But let's say that somebody's kind of just hovering. Okay, maybe it's a woman who's in her late 40s and she has not been keeping up with her muscle mass, let's just say, because she didn't know that that would be a good idea. And let's say that she's, BMI that's creeping up and she's entering menopause and all these things. Well, it's not going to get easier for that individual. Okay. So the idea is that person a candidate? And so as doctors, thinking outside the box, looking at all the criteria to be able to make a decision that's going to be unique to that patient. So we have to be, really creative in kind of predicting what may happen. And so it's not really fair to say that you're a candidate if you have this BMI. Okay, because there can be individuals who maybe don't meet that BMI but have metabolic disease. So let's talk about individuals who have PCOS. I have so many women clients that have PCOS. Now, maybe they're in the BMI range of 25 to 27. Okay, they might hit that 27 mark, but their hemoglobin A1C is elevated. Okay, and they are working their butt off. Exercise, nutrition, all the things. Okay, so that's an individual where they already have metabolic health that is not optimal. They are doing every lifestyle parameter and they're even, eating in a deficit most of the time, let's just say. And really, they're still starting to see the weight creep up and entering menopause, right? All right. So are we going to wait for a number? Are we waiting for a number? What are we doing here? Okay. So I just want to put this out there because, there's a lot more to the story, and we really have to trust that, the doctors that are practicing good ethical medicine and all those things, which, that's what we all signed up for, that, we're thinking about patients on an individual level and giving it to those who actually, can really benefit and can really become healthier and can really improve their longevity. Okay, so candidate, we obviously know the stone cold numbers. And again, we also have to look for other parameters of, dwindling metabolic health. So a lot of times when individuals start really increasing their waist circumference, they could have normal labs, but that's a sign of insulin resistance potentially. Okay, so, really starting to take this all very serious because we can prevent so much. And I think that that's really where I see the future of this. Prevention, right? We don't want to wait to have to go on a very, very high dose for a patient. Wouldn't it be great if they could just get a little spit of something just to help level the metabolic playing field so that their lifestyle parameters could work? Brilliant, really. Okay, so moving along then. So kind of candidate can be a little outside the box, but can also be very straightforward. I will tell you, I know plenty of people that are well beyond the BMI of 30. And again, I don't love the BMI, but that's what we have to work with here. That's what we have to submit for insurances and whatnot. But let's say well beyond that, who are not on medication because they can't tolerate the shame associated. Even though they've tried to lose weight 20 times, they're still convinced that this next time will be the time. Really giving them the affirmation that it's not their fault. Okay, there's so much that goes into metabolism and weight gain. It's genetics, it's environment, there's a lot, okay? So I think bringing up support system. One of the things that I find that individuals on GLP-1 agonists don't have are support systems. Many people don't understand their journey. Okay, so they get a lot of judgment. You're taking the easy way out. You don't really need that. Or you're taking the medicine from somebody who needs it. Like there's all this judgment. Okay. And so what I want to offer is that if you know somebody who is on a GLP-1 agonist and they've shared that with you, that's actually a big compliment. It means that they were comfortable enough sharing that with you. Okay. And what all individuals who are going through a health journey need is accountability and support. So really starting to think about, as humans, we are all in this together. And different people need different things to live their most optimal life, to achieve their most optimal health. So we really have to start honoring that some people may do better with a GLP-1 agonist. Some people may not need that. And we have to really kind of think about that everyone belongs and everyone matters. Okay. So let's move into kind of the trust of, pharmaceutical companies, because that's one of the things that comes up. The idea that, making money off of patients and whatnot. And what I'll tell you is that, over the next several years, things will change for sure. I also will say that, one of the biggest, I would say, judgments is that, all these people are on the medicine. Right. But then if it's so difficult to get the medicine, and as I mentioned, 4% of people with obesity are actually being treated with the medicine, that's not actually what's happening. Right. It's not that everybody's getting the medication. Now, there's a lot of different compounded medications. Again, I'm not talking about that today because I don't have a lot of experience with that because I mostly work with individuals who are already on a medication prescribed by their doctor. And then I help with exercise, nutrition, mindset work, all of those things. But I will tell you that I definitely have clients who are using compounded from a very good, compounding pharmacy. And so with all of that being said, right, oftentimes, it can be a little different with how those are prescribed. But I'm going to go through the same storyline. If somebody is going out of their way, they're going through the pros and cons, they're essentially signing up for the fact that they may have side effects. The medication is not the easy way out. The easy way out is that you have a normal metabolism and metabolic playing field and you don't have leptin resistance and you don't have insulin resistance and you could do exercise and nutrition and see results. That's the best case scenario. And that's not going to be the most common scenario, particularly as people are aging. Okay. So fun, right? I love talking about all of this because bringing it together is this next piece of where is this all going? Okay, so inflammation. inflammation leading to disease, knowing that GLP-1 agonists decrease inflammation. Okay, we know that it can help with heart disease. We know Alzheimer's, right? We know dementia. Like we know that there's so many things that are starting to come out, and it's starting to be part of that talk. Okay, so with that being said, in the next 20 years, there will be a protocol where individuals who are starting to get into maybe an area where maybe their lipids are going up a little bit and maybe their hemoglobin A1C is bumping a little bit. But if you're to look at them overall, things are going pretty well. If they're noticing, they're having a little more inflammation and all those things, low dose, microdose type of situation, you're going to see that more. You're going to see that more in preventative health as it relates to longevity. Okay. So the big push right now is longevity. So it's healthy longevity, vitality in longevity. Okay. And so one of the things that I'm telling you right now, in the next 20 years, we are going to start to see things a little bit different. We're going to start to see potentially, microdose type GLP-1 agonists being used in preventative measures for longevity. Okay. So, it's really cool because back in the day, GLP-1 agonists won an award for, medical innovation, right? And honestly, it saved lives. It's a miracle for many, and they're doing the work. Okay. So that's what we have to remember. Okay. The next thing is that the GLP-1 agonists have been around a long time. So one of the biggest things that you'll hear is, well, just wait. You just wait. You don't know what's going to happen. But the medication has been around for a very long time. We were just using it differently. And so what I'll say in terms of side effects, so you hear the scary ones, right? You hear like, pancreatitis, and you hear that potential for medullary thyroid carcinoma and all those different types of things. And the more typical ones are more typical. So, reflux, okay, nausea, even vomiting potentially, diarrhea, dehydration. These are things that are going to be more common. And are they side effects that actually happen? Yes, they are. Pancreatitis happens, okay? So again, somebody signing up for a medication is also taking on this idea that there is going to be some risk involved. Okay, so I'm putting this out there because I think we need to have massive compassion for our human population. Okay, everybody is on their own journey and everybody is trying to do their best. And really the purpose of this episode today is for you to be able to understand a little bit more about the medication and a little bit more about how it could potentially help people in your lives that are near and dear to you. Okay, that maybe need just a little boost in something. I said I would go back to leptin resistance because I have to definitely add this in. Okay, so for leptin resistance, your fat cells create leptin. Okay, that's where leptin is produced. When we have enough body fat, we have plenty of leptin. When we have low body fat, we have lower leptin. Okay, what happens with leptin resistance is that we have lots of leptin because we have plenty of body fat, but our brain doesn't sense that we have much. So our brain thinks that we're low on leptin. So our brain actually thinks that we're starving. What happens then? We slow our metabolism. That is the compensatory mechanism, slowing our metabolism. Okay, all right, well, that's interesting because guess what happens then? You need to eat even less food to lose any weight. That's what leptin resistance does. I've had individuals with significant leptin resistance who are eating 500 calories every 3 days and still not losing weight. Okay? It's a real thing. So if you hear somebody from the gym say, well, that's just crap. They're not eating in deficit. They're not logging their food. Granted, yes, we have to, check calories in, calories out while on the medication. But typically, if somebody's leptin resistant, they need the medication to be able to actually do that. Because if not, what's happening is they keep lowering their metabolic rate to try to prevent them from, starving to death. That's what's happening. So to find a calorie deficit is near impossible. And if we're doing that, the patients can have malnutrition. So yes, this is accurate. You can have a person who is overweight or in the obesity range who has malnutrition. Yes, you can. And it happens all the time. Okay. And so one of the things we could say here is that absolutely, this is where a GLP-1 agonist is kind of like a vitamin. Okay. It prevents the person from having malnutrition because they're actually able to eat food and lose body fat so they can optimize their health. All right. So much more we could talk on here. we're going to make this a series. We're going to go all in. We're going to give you some more episodes on this because I think it's really important to understand it on all these different levels. And honestly, even from the level of, supporting where you can too, because I'll tell you in my groups, that's one of the biggest things we struggle with is just a lot of shame around the use of a tool. Okay. So nutrition, a tool, exercise, a tool, mindset work, a tool, medication, a tool. They're tools. Okay. Using all the tools as people need to use them is where the money is. Okay. I love it. We have lots of amazing things for you. Okay. So we have 3 fitness programs year long, beginner strength year long, $199 for the whole year. And I lead every workout for you. You have 3 levels to pick from. Level 1, level 2, level 3. If you are somebody who needs to exercise from a chair, that's level 1. Okay. So it's for everyone. Second option, advanced strength. Somebody who wants 20 and 30-minute workouts. Okay. Somebody who exercise is not their first rodeo and you would love mindset coaching while you worked out. I lead every workout for the whole year. Your whole year is programmed. That's what I really want you to understand. When you sign in, your whole year of programming is in your calendar. Okay. Total fitness program. You get 10-minute workouts, 20-minute workouts, 30-minute workouts, yoga, meditation, my core and floor. Okay. $397 the whole year. So think about it this way. $397 and all of your fitness needs are met right in your app. Super easy, minimal equipment. I love it. It's so good. 3 coaching programs. Okay. The closest one coming up is nutrition training. It's geared towards healthcare professionals. However, if you're an individual that just wants to be an expert in nutrition, sign up. Okay. For healthcare professionals, doctors, 48 CME credits. Okay. And the beautiful thing about this program is that I'll be running it intensive for 8 weeks, and then you get a whole year of support with monthly Q&As. It's going to be awesome. This is probably the only time I'm running this one live. We start October 7th. We're going to link everything in the comments. If you are on a GLP-1 agonist and you want to be in a community with me and 5 other obesity medicine physicians managing your nutrition, managing your exercise, helping with your mindset. You have tons of support, 2 coaching calls every single week. You have all your exercise programming. You have everything. Okay. That's called optimal GLP-1 weight loss. And for my physicians, Transform. We are currently taking deposits for Transform 9.0. It's a year-long program. So we're keeping the price the same, but we're doubling the amount of time you get. So we're going from 6 months to 1 year at the same price. Okay. And it's going to be absolutely amazing. 72 CME credits, 2 coaching calls every week. All right. We do written coaching, all your exercise programming, your nutrition management, everything right there. Okay. If you are a doc who wants to do Transform and you are on a GLP-1 agonist, you get to have those extra calls in the GLP-1 group as well. Okay. So we just add that in for you. Great, great stuff. Super pumped about it. Cannot wait to go all in. And as always, I enjoy being here with you. And until next time, we'll talk soon.